Welcome to my poster. It is on smoking and health inequities. It's an environmental scan of smoking cessation services across Canada. I have nothing to disclose except the funding for this project from the Public Health Agency of Canada. I do have Ontario Ministry of Health and Long-Term Care funding for another project. Smoking increases health inequities, and if people can quit, it decreases those risks. Smoking is higher among young adults, people who live in rural communities, those with mental health and or substance use disorders, Indigenous, LGBTQI2S communities, and cessation is higher if you receive an intensive treatment versus self-help, but there are very few intensive treatments out there. So we performed a pan-Canadian environmental scan to find government cessation services to determine what they look like and if they did serve any of these priority populations. In terms of understanding smoking cessation programs, we can look at a step care model. The least intensive interventions are on the bottom, self-help. Those can be online, print, quit lines, texting, over-the-counter nicotine replacement therapy. And at the top of the pyramid are intensive interventions, maximal interventions, those defined by 5+ sessions in 1.5 to 5 hours, with or without medication or NRT. And in the middle would be clinical interventions or pharmacy interventions, less than 5 sessions. Program reach tends to be higher at the bottom of the pyramid, but those programs really don't work very well. Self-help is not that good in terms of helping people quit. There is a dose response, and those at the top of the pyramid do see the highest quit rates. We found 47 programs, government programs. All provinces and territories offer quit line and online self-help. That's the majority of what we found. We only found one intensive program, 14 moderate interventions through the clinics and pharmacies, and 12 groups, most of which met the criteria for maximum because they were 5+ scheduled groups. Very few specialized programs were found, as you can see in the table here. And so we conclude that most services are self-help. Very few are offered to the priority populations. And since we know intensive interventions work, we really should be working to disseminate efficacious intensive interventions to larger groups of the population.